Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
So I had ambitions to go to medical school, and I had taken a course called an emergency medical technician course because I wanted to have more experience and knowledge of medicine.
Yep.
And when I signed up for the course, I didn't even realize that it was for ambulance operations. So I was in college, I was an EMT, went to paramedic school, and at the time I was making a fairly decent wage as a paramedic. And I quickly learned that EMS, being a paramedic in the field, is a young man's game.
Yep.
So, and as I was not becoming a young man anymore, it became clear that I had to find a new route to go down. So I got out of the field and I became the executive director of an ambulance association. And those members were ambulance companies, Mike being and Action Ambulance being one of them. They said, you know, what you're doing is good, but we're really getting slaughtered by health insurance. What can we do as a group to purchase health insurance?
Oh, wow.
So that was the precipice of how MedTrans insurance got started. And then here we are today.
So that's crazy. So there wasn't, when I talked to many guests about kind of their path and how they, as you say, zig and zag before they land on insurance or healthcare.
Yep.
In your case, though, you were actually thinking about becoming an MD. You were a paramedic, right? So you're working in an ambulance and helping people. And you have this epiphany that, hey, you know, there's only so long I could do this.
That's right. That's right.
But then, you know, the thing that's striking is you actually made a pivot directly into captive insurance.
Yep.
And so that's remarkable to me that, you know, there weren't. Let's almost call it a zit. It wasn't a zigzag.
Yes.
Right. In your case, it was really kind of pretty quick.
From the employee's perspective, and my take on this is, you know, the biggest disruption is when you change from Blue Cross to Cigna.
Yeah.
The employee, that's what they care about, is my doctor in the plan, in the network.
Yeah.
And in our case, they are. I mean, if we've made a change, and we have made a change in the past between the carrier, it's easy enough for us to validate that, you know, 99% or 98%, whatever it might be, or even 100% of our employees' providers, regular providers, not, you know, the one-offs that they may have seen, you know, 10 years ago, but their primary care, their vision provider, whatever it might be, they're in the replacement plan. And that's, for the most part, what the employees care about. Can I go see my same doctor? So we focus on that. The other thing is, with that data, now you do see you can get access at the name level. For me to act on it, it's meaningless. But what we can find out, what, you know, some of Phil's tools can help us identify is who are there individuals that are leading to higher costs that we're able to talk to the employee about, or have a doctor or a nurse who's working with the carrier.
Sure.
Reach out to them to help them in their medical plan.
Yeah.
The place that I see it most often is, and this is probably a simple example, is we have a pharmacy benefit manager that can reach out to certain employees and say, look, if you get your medication through us, it's only going to cost, you know, a fraction of what you're currently paying by going to CVS or Walgreens or wherever you're picking it up.
Right.
And for certain meds, that's, you know, the employees, as long as we can't push the employees to do so.
Sure.
But if they're willing to switch over to receiving it through the mail,
sure,
well, why not? Because
right,
they're saving money, and ultimately we save money. Excuse me, as well.
Right. Right.
And the employee, it's, you know, agnostic. I'm getting my meds.
Yeah.
I can see the same doctors.
And that's huge, because what, you know, if you're in a traditional, you know, we call them in the vernacular in our business is the BUCAs, right?
Yep.
Blue Cross, United, Cigna, et cetera, et cetera. You don't have that control and that insight. And when you don't have that control and you don't have that insight, you're not in control, and then the plan is being managed instead of for the benefit of your organization and your people, it's being managed for the shareholders of the big giant insurance carriers. How is it that you can have a self-funded model and a captive model, but a major insurance carrier network? How is that possible?
So the employer is simply renting the network access. So BUCA, Blue Cross, United, Cigna, Aetna, they will grant access to their network for a fee. That's a per employee per month fee that an employer can contract with Cigna, and that allows the employees to feel like they have a Cigna coverage. The funding mechanism behind that is not really of the employee's eyes to see. They don't care how the bills get paid.
What else attracted you about it in terms of the mechanics? How did the mechanics work from a financial accounting perspective? What you were doing before versus this scenario?
I think the big thing that really comes into play is, as Phil said, that you as an owner, as a stockholder, you get essentially a return. You're earning whatever is not spent in the plan.
Yep.
Out of your premium dollars, not unpaid claims, but whatever the dollars are that are left in the plan after claims are paid.
Yep.
That's your profit. Now you get the benefit of that after a run-out period coming back to you. But you also get the benefit, and I know this is how it works with Phil. I don't know if this is how it works with other captives. You get the benefit of your premium dollars are paid in, and they're invested in the meantime, and you earn, at the very least, you're earning some interest back that gets allocated back to you at the end of the year. So I've got additional sources of income coming back into the company if we choose to take it back. We could leave it in the captive, or we could elect to take it, and it's taxable as a distribution. But if we leave it in the captive, we know that, okay, we've got money sitting there. In the event of claims that are exceeding our premium dollars, we could use those. Or if we someday want it, we can pull it back to the parent company.
Interesting.
So I'm going to geek out on some accounting principles.
Please.
So for our CPA friends that are listening, because you are the sole owner of your captive, it's considered a subsidiary to your business.
Okay.
Your business owns the captive. You're going to own 100% of your business, your captive insurance company. So you're going to be able to expense the premiums that are deposited into your captive, and then ultimately you're going to consolidate the financial statements between both entities. So in essence, that's left pocket, right pocket transactions. So you're literally picking up an asset every time you write a check to your insurance company, which is your captive. Today, if you're buying it from a BUCA, you're simply picking up the expense, and that's where it ends. So this is literally, you're turning an expense into an asset by owning your own captive.
Okay, so I'm not an accountant,
Yes.
right? But I understand debits and credits, and what I'm hearing you say is that you're essentially taking an expense, a debit, and you're moving it over to a credit essentially from one entity to another entity, and the other entity being the entity that you create for the captive.
What better arrangement could you ask for?
Very, very interesting. So why isn't everyone doing this?
Well, I think it boils down to the common bond of this captive arrangement is really sophistication. For consultants that want to embrace and learn this, they ask the same question, right?
Yeah.
I mean, it's like, well, why are you not doing it? We've turned our heads to employers at times when they say, "Oh, Phil, I love this product.
Yep.
I love it more if you can knock 10% off." And that's when the ball just drops, and I walk away, because that employer, CFO maybe or CEO,
right,
they don't get it,
right,
because this is not a transaction.
Right.
If you're looking to buy the cheapest policy, we're not necessarily it. Now, we're not more expensive than the market.
right.
But why on earth would you not want to fund your own insurance company so that it remains solvent?
Right. Yeah, that's kind of ridiculous.
That's right.
First of all, in insurance, you couldn't do that. Insurance is regulated.
Yes.
And you can't offer a cheaper price or a discount in the traditional insurance world. So someone asking that question, clearly doesn't understand the whole dynamic.
That translates to me that they're short-sighted.
Yeah.
Because you can either pay $100,000 to the BUCAs, or you can pay $100,000, call it $110,000 to your own captive insurance company.
Yep.
Well, if you do a good job and control your claims, you're going to walk away with $60,000 at the end of the year.
Yeah.
Do you want a pure expense, or do you want a $60,000 asset?
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.